views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Good evening. I am Errol Schneer, Bronx Lebanon Hospital Center's Vice President of Planning, Marketing, and Public Relations, your co-host for tonight's HealthBeat television program. We welcome you, our many viewers, and as always, we encourage you to continue participating in the program by dialing 718-960-7261 with any questions you may have. That's 718-960-7261. And we promise to do our very best to keep you medically informed and healthy by discussing the topics that are of interest to you. You can also find out more information about Bronx Lebanon and its many community services online at our website, bronxcare.org. Tonight, my co-host, Dr. Milton Gums, Bronx Lebanon's Vice President and Medical Director, and I will be discussing foot problems and how to address them.
Yes, Errol, as the summer season approaches, we increasingly become aware of the many types of foot developments, from the simple to the much more complex. Right. Joining us this evening are two experts in the field, Dr. Joanna Ayub and Dr. David Wong. Both our panelists will describe the full range of foot problems for the viewer, from the most simple to the more complicated. Welcome.
Thanks.
Now, before we hear from both of you, our panelists, let me once again encourage you, our viewers, to call in with any questions or comments you may have. The number to call is 718-960-7261. That's 718-960-7261. And please call us. Now, let me begin the program by asking both of you, and I'll start with you, Dr. Wong, first. Just what is podiatry? What makes it a specialized medical science?
Podiatry. Podiatry is the study of the diagnosis and treatment of diseases of the foot and ankle. It's a 4-year program. To get into the program, you have to take the MCAT,
right,
which is the medical college admissions test. Once you take that test and get accepted to podiatry school, it's a 4-year program. And once it's completed, there's a 3-year residency that you would attend. Once that's completed, you have the option to do a fellowship, a medical or surgical fellowship.
Right. Dr. Ayub, what did you find unique about these type of podiatry programs? What makes them special?
Podiatry, it's a specialization, but it's also a broad field.
Right.
You can treat the patient anywhere from dermatological diseases to sports medicine conditions to something that might require surgical intervention. So
it's really everything around the foot and up to the knee, I would say. Is that right?
Everything of the foot and the ankle with related structures up to the knee. Yeah.
Got it.
Now, let us hear a little more about the details regarding some of the specific conditions that you and podiatrists treat.
Some of the specific conditions can range from, as I said, anything dermatological, such as athlete's foot, or fungal nails, or warts, ranging to sports medical conditions where a patient comes in with pain, complaining of pain in their heel or pain in their toes or their ankles.
Yeah.
And then we can go on to diabetic foot care, where that involves a lot of dermatological, circulation, neurological studies. You would have to make sure that there are no open sores.
Yeah. What about that big bone there that comes out sometimes?
Big bunion.
Yeah, right.
Yeah, that's one of the most common conditions.
Is it an easy condition to treat?
Not necessarily. It's also not something that you have to treat if there's no pain involved.
Dr. Wong, are there any problems in terms of the foot that are specific to the Bronx, or is it fairly a common type of problem throughout?
The most common conditions we treat are usually heel pain, a lot of bunions, and mostly diabetic foot ulcers, also fungal infections. Heel pain is a very common one. Heel pain could be caused by an inflamed ligament that attaches to the heel bone.
Right.
A lot of nurses come in for injections.
Maybe because they're on their feet so much.
Yeah, so they come in for the quick fix, so we'll give them an injection, they get back to work.
Right.
But to help it heal, we offer orthotics, arch supports, stretching exercises, and that's pretty much
What does a routine visit involve
routine visit
for your foot? For a bunion?
For a bunion?
example.
For a bunion, we'll examine them. We'll send them to get an x-ray. Depending on the severity of the bunion, we either recommend surgery or not.
Yeah.
Usually we try conservative options first, such as orthotics, arch supports.
Right.
There's some bunion splints. They could stretch out the bunion to get out for pain relief.
Now, going back to diabetes, we often hear about the complications of diabetes in
Sure.
terms of the foot itself. Can you expand on that for us, Dr. Ayub?
Yeah, when you're diabetic, you're prone to certain problems that a person without diabetes can have. You can have vascular problems, you can have neurological conditions, and you also have immunological problems. So all of those can predispose you to problems such as ulcerations, such as even simple things such as dry skin or fungal nails, because your body is not strong enough to fight off the offending factors that cause it.
Right.
But ulcerations are a big concern of ours, that we always ask diabetics to examine their feet, to not walk barefoot anywhere, to always come to us as soon as they notice something is off, because those ulcerations, no matter how small or large they can be, they can lead to infections that can lead to a whole slew of problems from just a local infection to a more severe infection that can require an amputation to something that can even cause sepsis and even death.
Really?
Yeah.
Oh, so we really have to be careful out
Yes,
there.
definitely.
I could give you a surgical problem. Moving from diabetes to the issue of surgical intervention, what are the role of each of these that you participate in, for example? What types of surgery do you do, and what types of surgery do you do? Same?
I mainly focus on forefoot surgery, such as bunions, hammer toes, fractures also, trauma. I do a lot of ulcer debridements. I deal with foot infections. I did a 3-year fellowship in wound care, so I'm highly trained in wound care.
Every now and then you have some real problems, right?
Yeah. Yeah, so those are my main area of focus.
What about you?
She's in a different area.
Yeah,
More delicate?
Huh? No, more
No, not
advanced.
necessarily.
Actually more
Okay, tell
advanced.
it. Okay, good. No, tell it.
I do a fair share of forefoot surgeries, but I do enjoy rear foot and ankle surgeries a lot as well.
Now, why would one have a rear foot or ankle surgery? What are the reasons for that?
Well, pain is always the #1 concern. And the causes of that can be anything from arthritis in the rear foot area or heel spurs, whether on the bottom of the heel or on the back of the heel connected with the Achilles tendon. There can be Achilles ruptures that can occur. Ankle arthritis that can require ankle scopes or even further surgical interventions such as fusions.
Right. Now, Dr. Wong, you mentioned advanced surgery. What are we talking about when we talk about advanced surgery?
Dr. Ayub was trained in a 3-year surgical residency focused on rear foot surgeries as a 5-foot reconstructive surgery. Like she said, like the arthritis types of surgery. I wasn't trained to do rear foot, so I focused mainly on like the trauma surgery, the bunions, hammer toes, and wound care.
Okay.
Yeah.
And now we're going to get to those issues. Common foot problems you often hear about: athlete's feet, as you mentioned, hammer toe, bunions. How do these problems evolve, and what can our prospective community viewers do to prevent them from happening in the first place?
Okay. Well, bunions and hammer toes is usually hereditary. They're both muscle imbalances. Bunions and hammer toes can also be caused by tight fitted shoes. When feet are pushed into a certain position for a long period of time, they take on that shape. So prevention for that would be not to wear like tight fitted shoes for long periods of time, like high heels, narrow toed shoes. For fungus, causes of fungus, usually people that sweat a lot, excessive moisture, being in boots for long periods of time, public showers, public pools can cause fungus on the feet. To prevent fungus in the feet, the main thing is to keep the toes dry.
There's some patients who provoke that disease, don't they, when they wear the tight shoes?
Yes, like
With
high
some
heels.
cultures, right?
Binding, foot binding.
Yeah.
In China, they used to do foot binding,
Yeah.
and like I said, the foot takes on that shape for a long period of time if they have the foot in
And then they end up with
position.
a problem all their
Yes,
life afterwards.
same thing with bunions and hammer toes. If you wear narrow-toed shoes or high-heel shoes, the foot takes on that shape from the pressure.
Okay, let's find out what's a typical day at Bronx, Lebanon.
Typical day is pretty jam-packed.
Tell us.
It can involve us rounding on a typical amount of maybe 10 to 15 patients in the hospital that are inpatients. We also have clinic that can consist of about 20 to 30 patients a day, and then fielding calls for.
How do you divide it up?
There's no regiment. There's no strict regiment that we go along. We're just
Whoever's free.
we're just good team players, and whoever has some laxity in their schedule, they're able to go see a quick consult upstairs. If there is an emergency surgery that has to be done, then we would cover the doctor that would have to run for that.
So it's a well-oiled machine.
It is a well-oiled machine.
Yeah, we all get along, so it's not a problem.
Yes.
Now, how many are on your team? Sounds like you have
There
quite
should
a
be
number
more,
of
right?
people.
At least
should
two
be more.
right?
There should be more. We have 4 total.
4, yeah.
In the hospital, but we also have other doctors in the satellite offices as well.
Really? Oh, that's good. Yeah.
Yes.
Yeah.
Okay.
So you're happy?
We're happy.
It took a while,
I'm happy.
Right.
No, I'm happy.
Okay, now how does a patient or a prospective patient gain access to your service? Where are you located? Is there a number that they can call?
Yes.
Or could they just walk in?
So we're located on the 7th floor of Bronx Lebanon Hospital. We're open Monday through Friday, 9 to 5.
Right.
We take all walk-ins.
Right.
To reach us, you can call us at
99 Bronx number, I would imagine.
99 Bronx or 718-518-5814. That's the office number.
They call the operator too sometimes. It
You
takes
can
a
call the
little while
operator and they
sometimes.
can set up an appointment.
Very accessible.
But we take walk-ins, so it doesn't,
All right.
you just walk in.
Yeah.
Okay.
Yeah.
Now, on that note, let's pause for a short break, and when we return, we will continue our discussion, as well as take calls from you, our viewers. Once again, the number to call is 718-960-7261. That's 718-960-7261. And please call us.
During this, our year of women's health, we take pride in the extraordinary success of our women's health programs. And when it comes to caring, our OBGYN team is second to none.
At Bronx Lebanon's Women's Health Center, its labor and delivery unit, and Center for Gynecological Care, services are provided in a welcoming environment.
Women in the Bronx can always depend on our OBGYN team for expert, compassionate, and highly specialized care. We deliver the best in women's health services.
Bronx Lebanon's intensive care unit is providing treatment for pregnancy and gynecological related conditions.
We work with our multidisciplinary team to stabilize our patients. Following discharge, we refer them for outpatient care at our Health and Wellness Center.
Winning the battle against breast cancer represents another crucial challenge.
At our breast cancer center, we've implemented a comprehensive approach. Biopsy, which is clearly succeeding in the detection of early cancer.
Significant progress is also being made in the treatment of colon cancer.
Today, I will be performing an endoscopy. Our goal is to prevent cancer. By performing endoscopy and colonoscopy, we are identifying lesions which can be treated at the time of the procedure or referred for surgery.
When illness occurs, Bronx Lebanon's nurses are providing excellent and compassionate care.
We pride ourselves in understanding the physical and emotional needs of our female patients, closely monitoring their well-being and preparing them for the miracle of childbirth.
In the ER, we see some of the most dramatic examples of the Bronx Lebanon team in action.
A high percentage of the patients seen in the emergency department are women, and we are sensitive to their needs. But what is also important is that our ER is helping patients overcome all types of emergency situations.
And keeping its female and male patients moving in the right direction is Bronx Lebanon's Department of Orthopaedics.
Our programs are among the best in the nation in treating bone and joint problems, including hip, knee, and shoulder replacements, as well as spine, hand, and foot surgery.
The Department of Family Medicine is another Bronx Lebanon success story.
The close relationship we have developed with women and their families has become the driving force in our efforts to provide comprehensive primary care to the community.
Bronx Lebanon is also leading the way in anesthesiology, dentistry, ear, nose, and throat, men's health, neurology, ophthalmology, pathology, pediatrics, psychiatry, radiology, medical education, and long-term care, as well as through its Bronx Care Outpatient Network, and with the completion of its Health and Wellness Center for Ambulatory Care, Life Recovery Center for Chemical Dependency, and selection as a New York State Performing Provider System lead. Bronx Lebanon is positioned for continued success.
Welcome back to HealthBeat. We come to you live on BronxNet every Monday evening from 6:30 to 7 p.m. Please call us at 718-960-7261 with any questions you may have, and we will certainly do our best to answer them. That's 718-960-7261. Now, before we continue our discussion, I understand we have a caller with a question this evening. Alberto, you're on the air.
Yeah, good evening. I have a kind of like a two-part question. One is, I was a professional boxer for quite some time. I'm almost 15 years. And from bouncing on the ball of my feet for many years, I now find that the padding in the ball of my feet is just about gone. And when I walk barefooted, I can literally feel my bones hitting the floor. Is there something that can be done about that? And does soaking your feet in Epsom salt, does that help in any way?
You heard the question?
Do you want to, Dr. Ayub, answer the question for Alberto, please?
Well, soaking in Epsom salt can help you temporarily with pain relief, but it wouldn't do anything for the long term. Something that you can do for when you're wearing shoes is that you can wear orthotics with a special pad in it. I would probably prescribe something called a metatarsal pad, which is a pad that would go right below the ball of your foot, so that when you're walking in your shoes, you would put more pressure on the pad versus on the ball of your foot where you have lost some of your fat padding. Surgically, there is not much to do, but I would still recommend you see a podiatrist, because sometimes there is an abnormal level where one of those bones in your ball of a foot are pointing, and that can sometimes be surgically repaired.
Thank you very much. This is exactly where I was going.
Yeah.
Tell us the recipe for foot care, not avoiding the podiatrist. So he's there with the podiatrist, but you can tell us about the foot care.
What do you mean by recipe?
In other
for
words,
foot care?
how can an individual such as Alberto
Avoid
avoid the need to go to a podiatrist such as either of you?
I see. Well, I'll defer that to Dr. Wong.
Well, someone like Alberto's, he has pain in the balls of feet and he doesn't have much cushion, so an orthotic would definitely help him. We would recommend stable shoe gear, shoes with a lot of support, a lot of cushioning. As far as foot health, always keep the foot moisturized, keeping the skin healthy, keeping the toes dry in between the toe spaces.
Yeah, but what's the, you also mentioned that diabetics should be careful with water, a lot of water, right? So
soaking, diabetics should not soak their feet.
Excuse me, we have a call from Jack. Jack, you're on the air. Is Jack on the air?
You have the question, Jack?
Yes. So I have a question regarding what is the best way to prevent foot-related injuries with running, and is there a type of footwear that you recommend to provide better support to your feet to avoid such issues?
So they're looking at each other, both of you, anyone.
There are several shoes out there. It all depends on your foot type. Some people are flat-footed, some people have high arches. People with flat foot would benefit from orthotic in their shoe. no matter what shoe you're wearing. People with high arches also would benefit from our arch support because because people with high arches put a lot of pressure on the muscles that hold up their arch. So that would definitely help. Are you talking about shoe gear?
I guess not just shoe gear, but in general, I guess ways to determine like best ankle support or just any way to avoid an injury that could occur from either long distance running or high impact exercise or anything that would be strenuous.
Basically, you really should stay conditioned. Ankle braces do help, or foot ankle braces have a lot of foot support and ankle support. When I run, I wear my braces, even though I don't have any issues. But I think that's one of the reasons why I don't have issues, because I have that support when I'm running.
Dr. Ayub, you have anything to add to that?
Yeah, I think a lot of emphasis should be placed on stretching as well before and after you're exercising. That can prevent a lot of problems. And also, just listen to your body. If you're feeling any slight tinge of pain, don't continue running. And definitely just see how your foot reacts once you rested. If the pain comes back, especially in the same area, listen to it. Come to the doctor and see if there's something that's more serious that should be addressed.
Okay. Moving on to the next question. We often hear about over-the-counter remedies for foot problems. What's your feeling about these over-the-counter remedies? Foot powders, sprays, creams?
The powders are good. We also prescribe antifungal powders, but they're pretty much the same as the over-the-counter antifungal powders. As far as warts, over-the-counter products definitely work for warts.
And when are prescription medications called for? Are there certain conditions where you have to do that?
So for infections, any type of foot infection, antibiotics, you can't get that over the counter. Antifungals, if you have a severe fungal infection, the topicals won't work if it's severe. That's when you would want to get a prescription for antifungal.
Okay.
This is not a tricky question, but you're in the department of orthopedics, and you have other people allied working with you. How's the reaction? How's the interaction?
It's very good. There's a good referral process that occurs between all of us. I can receive a patient that has a lot of pain in their feet, but they also have a lot of pain in their hips. So you can't really ignore one part of the body and only treat the other.
So it's a smooth relationship.
Oh,
Yeah,
definitely.
Definitely.
And what about some of the other specialty areas?
Like for back, people with numbness down the feet and legs, we would refer them to the spine doctors. And the other specialties, like we work closely with in the hospital, like infectious disease, family medicine, vascular, they're all on board when we have an infection in the hospital. Yeah, we make sure everyone's on board.
Okay, good. Now, a question we often ask our panelists is to share their patient successes with our viewers, and I'm sure both of you in your fields have had many successful outcomes. Can you share one with us, Dr. Ayub?
Yes.
That comes to your mind?
Sure. One that I'm specifically proud of. It's a person that had a back injury where a tree fell on his hip, and over the years it caused him a neurological problem that pretty much caused his hip to fuse into one spot and his foot to turn into an adult club foot, where his entire foot was curved and he was walking on the side of his ankle. So I worked closely with the hip doctor. I performed my surgery first, where I realigned his entire foot so that he was able to walk flat on it. And then the hip doctor was able to unfuse the hip and placed a hip replacement. So this patient was able to walk and was happy.
And what about you, Dr. Wong?
A specific success story. Actually, I feel with a lot of ulcers at the hospital. Although those were very dear to me. Diabetics, HIV, ulcers. But the one thing that stands out to me is I had a friend recently that came in. She had very painful bunions on both her feet. She could barely go to work. She went through several doctors in Manhattan. They all wanted to charge her a lot of money to correct her bunions. So I did it here, and every day she calls me to thank me, pretty much. So that one sticks out to me.
That's definitely a great success.
Yeah.
Okay, Dr. Gums, did you want to ask about the...
What types of sport injuries do you see, and what is your role in the game day, same day program at Bronx, Lebanon?
Whoever. I treat a lot of Achilles ruptures.
Well, that's
pretty bad sometimes, I would imagine.
They can be, and sometimes it's a simple repair, and sometimes it requires tendon transfers and whatnot. We both treat a lot of fractured bones.
Went to a patient with that once?
A long time ago, yes.
Yeah.
Oh, really?
Your group was very,
yeah.
very successful in treating me, right?
Yeah,
away.
there's an intensive rehabilitation to it. And the same day, game day program is something that we implement where if there is a sports injury, we definitely make time to see the patient the same day.
Yeah. No, that's terrific.
And we'll take them to surgery right away.
Yeah. Okay. Now, in the time remaining, perhaps each of you can give our viewers a general recipe for successful foot care, particularly as the summer is ahead of all of us. I'll start with you, Dr. Wong.
Our population is mainly diabetic. There's a lot of diabetics in our population. So for diabetic foot care, diabetics should take extreme caution with their feet. They should inspect their feet daily, making sure there's no cuts, scrapes, corns, redness. If they can't check their feet on their own, they should have a family member or a friend help check them for them. They should not soak their feet, like I said. They shouldn't soak their feet in hot water or warm water. They should not use heat pads. Proper shoe gear is very important for diabetics, which is one of the reasons why diabetic shoes are covered by insurances.
Good.
And also, diabetics that smoke should think about
stop.
quitting. Yeah, because smoking greatly reduces circulation, especially to the feet.
And Dr. Ayub, any quick recipes for foot success for the summer?
Don't walk barefoot if you feel, definitely be aware of your surroundings. Be careful with flip-flops. If you have any pain, do not wear flip-flops. If the flip-flops are causing you pain, do not continue with the flip-flops.
Okay. And on that note, let me thank both of you, Dr. Ayub and Dr. Wong, for joining with Dr. Gums and myself on tonight's HealthBeat television program.
Thank you for having us.
Thank you.
And most importantly, let me thank you, our viewers, for tuning in this evening.
If any of our viewers have questions or need assistance, I encourage them to call our physician referral service by dialing 718-99-BRONX. That is 718-992-7669. Or you can refer to our website at bronxcare.org. Good night, and see you next week when we will be discussing another important health topic from your Bronx community.